7 tests and procedures that can raise your stroke. Risk after 60. Did you know that after you turn 60, some seemingly safe tests or procedures could be secretly putting your health at risk? From a simple sedative to an ultrasound or an X-ray to those just-in-case tests, they can all tire out your body, cause anxiety, and even lead to unwanted complications. In this video, I'm Dr. Ryan Davis, and I'll be sharing some things most patients over 60 have never heard before, so you'll know how to better protect yourself. If you're interested in living a healthy, safe, and happy life in your golden years, hit the subscribe button for the Senior Care Wellness channel right now. This is where we'll be on this journey together, so every year ahead is stronger and more fulfilling. 1. Colonoscopy with anesthesia. You know, when we hit our 60s and 70s, every doctor's appointment becomes a big deal. Sometimes it's just a routine checkup, but it ends with the doctor suggesting a procedure we never even thought about, like a colonoscopy or an EGD. It sounds reasonable. Who doesn't want to make sure they're healthy and that nothing is wrong? But at this age, our bodies don't react like they did in our 40s or 50s. They're more fragile, more sensitive, and sometimes even small things can cause big problems. I want to tell you about Martha, a 72-year-old woman from Ohio. She's a kind lady who still tends to her garden every day. She takes her blood pressure medication regularly and an aspirin for prevention, just as her doctor advised. She didn't have any specific symptoms. Her doctor just suggested it was time for a colonoscopy to be on the safe side. She agreed. The day of the procedure, she was given a light anesthetic so she wouldn't feel the discomfort from the scope. Everything went smoothly, and she went home feeling fine. But 2 days later, she noticed her speech was difficult to control. Her words were jumbled, and her left hand was clumsy. She couldn't even hold a glass of water. At the hospital, the doctor's conclusion was that she had experienced a transient ischemic attack or a mini-stroke. The news stunned her. The question that came out in tears was, "I went for a procedure to get healthier, but I came back with a mini-stroke." Martha's story isn't rare. After the age of 60, our bodies are much more sensitive. The combination of sedatives from anesthesia with blood thinners like aspirin, warfarin, or Plavix can cause a rapid drop in blood pressure, reducing blood flow to the brain. And just one tiny blood clot going in the wrong direction can be enough to create an incident that should have never happened. In your 40s or 50s, your body can easily compensate for these small changes. But the older you get, the less your cardiovascular and nervous systems can balance themselves. Just a small fluctuation can leave a lasting mark. Science has shown this too. A 2021 study revealed that patients over 65 who underwent colonoscopies with anesthesia had a higher rate of experiencing transient ischemic attacks within 72 hours after the procedure. This number didn't make headlines, but to me it's enough to make you think, because every percentage point increase means thousands of real people going through an unwanted incident. What I want to emphasize here isn't to make you afraid of colonoscopies. Colonoscopies are an incredibly important tool. They can save your life by detecting early colon cancer or dangerous polyps. But I want you to be more aware and realize that adding another procedure isn't always better. Sometimes the price you pay is your own safety. So I always advise my patients ask questions before agreeing to anesthesia. Can this procedure be done without deep sedation? Are there safer options for someone my age? What could happen if I postpone it? Sometimes a simple stool test for hidden blood or regular symptom monitoring is enough. And if a colonoscopy is truly necessary, choosing lighter sedation or even no sedation is absolutely something you can discuss. I remember another patient, George, who was 78. He said, "I saw my best friend have a colonoscopy and then get complications. I don't want to repeat that." We went over his medical history and the medications he was taking. And in the end, we decided to postpone the procedure. Instead, we monitored him with tests and an abdominal ultrasound. 3 years later, he's still healthy and sharp. And most importantly, He feels he truly owned his own decision. Looking back, I realized that health after 60 isn't about doing every test just to be sure anymore. It's about knowing which tests you need and skipping the ones you don't. Every body is a unique story, and you have the right to keep writing that story, instead of just following a pre-written script from the hospital. For a younger person, a small scratch in the vascular system will heal quickly. But for an older person, that scratch can become a permanent scar. So whenever a doctor suggests a colonoscopy with anesthesia, be bold and ask, is there a gentler way? Make sure the doctor knows exactly what medications you're on. And have a careful discussion about the risks before and after the procedure. I've lived for 60 years and have seen it all, the miracles of modern medicine and the heartbreaking lessons of trusting standard procedures too much. I'm not telling you this to make you suspicious of hospitals, but to give you more awareness so you understand that your health starts with the questions you dare to ask. And sometimes, the smartest choice isn't to do one more procedure. It's knowing when to stop. 2. Routine. Carotid artery ultrasound. Have you ever had a doctor mention getting a carotid artery ultrasound? These are the big blood vessels on both sides of your neck that carry blood to your brain. Many people over 60 are advised to get a routine check to see if there's any plaque buildup on the artery walls. It sounds reasonable because who doesn't want to know what's going on inside their body? But the truth is, sometimes the results lead us to make bigger decisions than are really necessary. I remember Richard, a 75-year-old man who was tall and loved to fish at the lake near his house. He got a carotid ultrasound during a routine checkup. The results showed he had a moderate amount of plaque, not enough to cause a blockage, but not completely clean either. Immediately, he was referred to a vascular surgeon who suggested he get a stent to prevent a stroke. Richard was confused. He asked me, "Doctor, I'm healthy and I don't have any symptoms. So why do I need surgery right now?" I sat down and explained to him that in many cases, a moderate amount of plaque doesn't necessarily need surgical intervention. In fact, lifestyle changes, controlling blood pressure, lowering cholesterol, regular exercise, and taking statins can sometimes be more effective than rushing into an operating room. Science has shown that for people without symptoms, carotid artery surgery doesn't always lower the risk of stroke like we think it does. On the contrary, the surgery itself carries its own risks, bleeding complications from anesthesia, or even causing the very stroke we're trying to avoid. It's a paradox that few people want to hear, but it's the truth. This doesn't mean that carotid ultrasounds are bad. They're genuinely valuable if you have symptoms like a fleeting numbness on one side of your body, slurred speech, or a history of mini-strokes. But if you're completely healthy with no symptoms, finding a moderate plaque buildup can sometimes just cause more worry and lead to unnecessary surgeries. I often tell my patients to imagine their body is like a garden. There might be some rocky, imperfect soil, but the plants are still growing well. Do you really need to dig up the whole garden just because of a few rocks? Or can you just take better care of it, water it regularly, use the right fertilizer, and let nature do the rest? Plaque in your carotid artery is the same. Sometimes the best solution isn't immediate intervention, but nurturing your health every single day. I'm telling you Richard's story to show you that health isn't just about what a scan or an ultrasound says. It's also about how we live every day. When he decided against surgery and instead changed his diet, started walking daily, quit smoking for good, and took his medication as prescribed, his health gradually stabilized. 3 years later, he still goes fishing every morning, still drives his grandkids to school, and most importantly, he didn't have to go through a risky surgery because of one ultrasound result. So the next time a doctor suggests a routine carotid ultrasound, I hope you'll ask yourself, do I have any symptoms? Do I really need this test right now? And if the results do show plaque, calmly discuss it. Are lifestyle changes and medication enough? Is surgery needed right away? Health after 60 is a journey of balancing what we know and what we don't, between intervening and letting go. Sometimes the smartest choice isn't to rush into the operating room, but to slow down, take better care of your body, and trust that simple things like healthy eating and daily walks are enough to protect your heart and brain. 3. CT scans with contrast dye. Do you remember the last time you had a CT scan? Maybe you recall that warm, spreading feeling throughout your body when the nurse injected the contrast dye into your vein. They often tell you it just helps make the images clearer, so the doctor can see your blood vessels, heart, kidneys, or brain better. It sounds simple, but the reality behind it is more subtle and complex. I've had many patients over 60 tell me they felt a little dizzy, nauseous, or had their heart race after getting the contrast dye. Most of these reactions pass quickly, but sometimes they're a warning sign. You see, at this age, many people have high blood pressure, a weak heart, or kidneys that don't work as smoothly as they used to. These factors make contrast dye like a risky test. It can cause a sudden drop in blood pressure, or on the flip side, make it spike in a matter of minutes. And in that fragile moment, the risk of a stroke or heart attack can unexpectedly appear. I still clearly remember the story of James, who was 81. He just had a mild stomach ache, and his doctor ordered a CT scan with contrast to be on the safe side. At the time, he felt normal, even joking with the technician. But 2 days later, he was admitted to the hospital with a small stroke. When they analyzed his case, the doctors believed the contrast dye had caused his blood pressure to spike, which was enough to make a blood clot travel to his brain. Luckily, he recovered, but he told me with sad eyes, "If only I had known, I would have asked more questions." That doesn't mean CT scans with contrast are bad. On the contrary, they've helped many people find cancer early, detect blockages, and save lives. But the problem is, they aren't always necessary. Sometimes a CT scan without contrast is enough for a doctor to make a diagnosis. Sometimes an ultrasound or an MRI can provide a clear answer without putting more chemicals into your body. The important thing is for you to become the one asking the questions. Before you agree, ask your doctor, "Can we do this scan without the contrast dye? Is there a safer option for someone my age?" And if you have a history of high blood pressure, heart disease, or kidney problems, make sure the doctor knows about it before you step into the scanning room. A simple blood test to check your kidney function can sometimes be enough to give both you and your doctor peace of mind. I always remind my patients that health after 60 is like walking on a bamboo bridge. It's still sturdy and will get you to the other side, but one wrong step or one strong shake can make you wobble. The contrast dye in a CT scan is that shake. It won't make the bridge collapse, but if you're not careful, it can make you lose your balance. So slow down, ask more questions, and never be afraid to ask your doctor for a detailed explanation. Because sometimes the wisest choice isn't to agree right away, but to find the safest path for yourself. 4. MRI with gadolinium contrast agent. Have you ever heard of gadolinium? The name might sound unfamiliar, but if you've ever had an MRI with a contrast agent, then your body has likely been exposed to it. Doctors often explain that the contrast agent just makes the images clearer, so they can see your blood vessels, nerves, or deep injuries in your brain, liver, or kidneys. But what's rarely said is that gadolinium doesn't just go in and then disappear, especially when age has made our kidneys work a little more slowly. After 60, the human body is like a machine that has been running for decades. It's still working and durable, but some parts aren't as smooth as they used to be. Your kidneys are one of those parts. They're supposed to filter everything we put into our bodies. But when kidney function declines, a small amount of gadolinium can get held back and not be fully flushed out. And it's that getting stuck that worries experts. I still remember the first time I met Harold, a 79-year-old veteran from Arizona. He came to see me because of chronic back pain that had bothered him for years, and nothing had helped. Another doctor had advised him to get an MRI with gadolinium to get a clearer look at his nerve roots. He thought, I'm used to the battlefield. A shot is nothing. The MRI went fine, and he went home without any immediate problems. But just 2 days later, he started feeling exhausted, dizzy, and his memory was hazy. His wife noticed he was suddenly forgetful, and sometimes he would stand in the middle of the kitchen and forget what he was supposed to be doing. When they ran blood tests, they discovered Harold had kidney function decline that he hadn't known about. It's likely that gadolinium was the factor that overloaded his body, contributing to those symptoms. Harold sat across from me, his eyes tired and dull, and he said something I'll never forget. If I had known I just needed a blood test first, maybe things would have been different. Harold's story isn't an isolated case. In fact, there have been reports of gadolinium building up in the brain even in patients with perfectly healthy kidneys. We don't fully understand the long-term effects, but some studies show a link to symptoms like headaches, dizziness, temporary confusion, or the brain fog that many older people describe. For younger people, the body usually adjusts on its own. But for anyone over 60, when the brain and circulatory system are already fragile, even a small impact can make a big difference. The important thing here isn't to be afraid every time you hear about an MRI. An MRI is a very powerful diagnostic tool, and it doesn't use X-rays like a CT scan, so it's inherently safe. The issue is with the contrast agent and whether we ask the right questions before we agree to it. I often advise my patients to get a simple blood test called GFR before getting an MRI with gadolinium. It tells you how well your kidneys are filtering. This number is like a roadmap. If your GFR is low, gadolinium could be risky. If your GFR is good, the risk is much lower. It only takes a few minutes, but can help you avoid a whole host of complications later. And here's a question you should always have in your back pocket. Can I get this MRI without the contrast agent? You might be surprised to find that in many cases the answer is yes. For large injuries or straightforward vascular issues, an MRI without contrast can provide clear enough images for a doctor to make a diagnosis. So why put extra chemicals into your body if you don't really need to? You know, sometimes I think the human body after 60 is like an ancient tree. Its roots run deep, its trunk is gnarled, but it still stands strong. The thing is, a small cut to the bark can leave a permanent scar. An MRI with gadolinium, if used correctly, can help protect the tree, but if overused, it can also become an unnecessary cut. I want you to try and imagine this. You're walking across an old wooden bridge. With every step, the bridge creaks, but it's still sturdy. Gadolinium is like an extra weight added to your backpack. If you're still strong, the bridge can handle it. But if the bridge is already weak, adding more weight can make it wobble. So why not lighten that load if you don't absolutely have to? Some people will ask, so should I refuse an MRI with gadolinium? My answer is not necessarily, because sometimes it really is needed for a doctor to see dangerous things like a small tumor, a blockage, or brain damage that no other tool can find. But what you should do is always ask, always consider, and always make sure that the decision is based on your body, not just because it's the standard procedure. Health after 60, you see, isn't just about fighting off illness. It's also about learning to listen to your body, learning to ask questions, and learning to know when to stop. Harold told me after his experience that he started to see his health as a conversation, not just with his doctor, but with his own body. He learned how to ask, how to choose, and he found a lot more peace of mind. I hope you do too. The next time you hear about an MRI with gadolinium, don't rush to say yes. Pause for a moment, check your kidneys, ask if it's really necessary, and consider a safer option if there is one. That's not being stubborn. It's being responsible to yourself and to the people who love you. 5. Over-testing. The dangers of too many tests. Have you ever heard the phrase, just to be safe? Many people over 60 come to me and say, Doctor, I want to do all the tests. The more the better. That's the only way I'll feel at ease. It sounds reasonable, right? Who doesn't want to prevent a problem before it starts? But what most people don't know is that sometimes doing too many tests can lead us into a spiral of worry and unnecessary medical procedures, even when our health is actually fine. I remember a patient of mine very well, Eleanor, a 68-year-old from California. She was very careful, read a lot of health news, and every year she would ask her doctor for a full workup from blood and urine tests to a full-body CT scan. Once the results showed a small, cloudy spot in her lungs. She panicked, her whole family was worried, and the doctor recommended a biopsy. In the end, it was just a benign calcified nodule, completely harmless. But before she got the results, Eleanor had sleepless nights for weeks, living in fear that she had cancer. After the biopsy, she even had a minor bleeding complication and had to stay in the hospital for a few extra days. You see, a healthy person who went in just to be safe ended up with anxiety and an unnecessary procedure. This is the downside of over-testing. When you do too many tests, the chances of finding a small abnormality are very high. But not every abnormality is something to worry about. The human body is naturally imperfect. After 60, some of your blood numbers might be a little higher than normal. You might have some old scarring on your liver or a small calcified spot in your lungs. These things are sometimes just the marks of time, like wrinkles on your face or gray hairs on your head. But when they show up in a test result, they're called abnormal, and that's when we start to panic. A study in the U.S. showed that among people over 65 who got routine full-body CT scans, even without symptoms, up to 30% were found to have clinically insignificant findings. This means they saw something, but they didn't know if it was harmful or not. The result, many people had to undergo more biopsies and procedures, and it was those procedures that created real complications. I often tell patients that medical tests aren't a perfect map. They're like a magnifying glass. They can zoom in on small details so much that we sometimes forget the bigger picture. And when we look too closely, we can get scared by things that don't actually pose a risk. More importantly, after 60, everyone's body is different. No one needs the exact same set of tests. Someone with diabetes needs to monitor their HbA1c regularly. Someone with high blood pressure needs regular kidney and heart tests. But a healthy person with no symptoms doesn't necessarily need a comprehensive blood panel or a full-body scan just to find something wrong. That's not prevention. Sometimes it's just creating more worry. Have you ever thought about this? Worry is a disease too. It makes your heart beat faster, shortens your sleep, and raises your blood pressure. And many times that worry doesn't come from an actual illness, but from a results sheet with numbers outside the reference range, even when there's nothing seriously wrong. The body after 60 is like a thick journal full of the traces of time. Every test is like turning to a random page and scrutinizing it closely. But if we focus only on every small smudge of ink, do we still see the beauty of the whole story? So what's the solution? I always emphasize personalization. Don't get a test just because everyone else is doing it, or because you heard the more the better. Base it on your personal health history, pre-existing conditions, lifestyle, and actual symptoms. If you don't have any signs of a problem, sometimes what you need isn't another test, but a good night's sleep, a healthy meal, and a slow walk in the park. I love this saying. We don't need to find every speck of dust in the house, just clean up what's really getting in the way. It's the same with health. Instead of hunting for every small trace with a bunch of tests, focus on the real risk factors like controlling your blood pressure, blood sugar, and cholesterol, and keeping your mind at ease. After her experience, Eleanor finally realized this. She came to me and said, "Doctor, I think I need to learn to trust my body more than I keep scrutinizing it." Since then, she only gets the tests that are truly necessary based on personalized advice. As a result, she feels lighter, less worried, and is enjoying her golden years a lot more. I want you to remember one thing: modern medicine is an amazing tool, but a tool is only useful if you use it the right way. After 60, every test isn't just a number, it's a decision about your quality of life. And you have the right to choose not to do it just to be safe, but because it's truly necessary. 6. Stress test, treadmill, stress test. Have you ever seen that familiar scene in movies? A middle-aged person getting on a treadmill in a hospital, wires taped all over their chest, with a doctor standing by, monitoring their heart rate. That's a stress test, also known as an exercise electrocardiogram. The idea is simple: to see how your heart reacts when it has to work harder than normal. But for people over 60, this test is sometimes not so simple at all. When we're young, our heart is like a new engine. It can rev up and slow down smoothly. But after turning 60, that engine has some wear and tear. Some blood vessels have narrowed, and artery walls are less elastic. So when a stress test forces the heart to go full throttle, for a few short minutes, the risk of an incident increases. I once witnessed a patient named Robert, 74, a tall man who was very confident about his health. He told me, "I still play golf every week, doctor. A small test is nothing." But while on the treadmill, his heart rhythm suddenly became chaotic. His face turned pale, and his blood pressure spiked. The doctors had to stop the test immediately. Luckily, he didn't have a heart attack, but the shock made him realize that even a seemingly healthy person can be at risk when their heart is put under sudden pressure. Do you know why this happens? When your heart is at rest, many potential problems can hide for a long time. But when we force it to work hard, narrowed blood vessels might not be able to supply enough oxygen, leading to arrhythmias, chest pain, or even a ruptured blood vessel in the brain in the worst cases. And for older adults, the cardiovascular system is less adaptable, so the risks are even more apparent. This doesn't mean stress tests are bad. They're still an important tool for diagnosing heart conditions. But the question is, do you need one, and is there a safer option? Often, instead of having an older patient run on a treadmill, we can use medication to create a similar reaction, which is called a pharmacological stress test. Or in many cases, a simple resting echocardiogram can clearly show how your heart is functioning. I had another patient, Linda, 69, who often felt anxious but was afraid of strenuous activity. When her doctor suggested a treadmill stress test, she was terrified, saying, "I'm afraid I'll fall." After considering her options, we chose a resting echocardiogram combined with blood tests and blood pressure monitoring. The results were enough to determine her heart's condition without her having to run on a treadmill. She smiled and said, "Thank you, doctor. I feel so much more at ease." You see, medicine doesn't always follow a rigid formula. After 60, every medical decision needs to be personalized. What's right for a 40-year-old might not be safe for a 70-year-old. And the important question you need to remember when a doctor suggests a stress test is there a less risky way to do this? I often compare a stress test to testing the durability of a bridge. If the bridge is new, you can run a whole fleet of cars over it to test it, and it will hold up. But if the bridge is old, just a few heavy vehicles can make it dangerously shake. Instead of forcing the bridge to endure, sometimes you can just observe it from a distance and inspect its structure, and you'll know if it's safe or not. Some people ask me, "So doctor, if I don't do a stress test, what if I miss something?" The answer is, there are many ways to understand your heart without pushing it to its limits. An echocardiogram, blood test like troponin, or a coronary CT scan are all useful tools. The key is choosing the right tool for your age and health condition. What I've learned after many years is this: healthcare after 60 isn't just about finding diseases to cure. It's also about learning to live wisely with your body. More tests and more strenuous challenges don't always mean more safety. Sometimes safety comes from knowing when to stop. Robert, the man who once thought he was healthy as a young guy, learned a lesson from his treadmill experience. He told me, "I don't think proving how healthy I am as an old man is worth it anymore. I need to learn to listen to my heart instead of forcing it to run to satisfy my ego." I think that statement isn't just for him, but for all of us. So if you're considering a stress test, I want you to remember 3 things. 1. Ask your doctor if there's a safer alternative. 2. If it's absolutely necessary, make sure there's a full medical team ready to handle any complications. And 3, never forget that your health isn't a race. It's a long journey that requires patient listening and care. And perhaps the most important message is this: after 60 years, your heart doesn't need to be proven, it needs to be protected. 7. Sedatives and sleeping pills before a procedure. Have you ever been given a small pill before a medical procedure? Maybe it was a sedative or a mild sleeping pill to help you feel less anxious and more comfortable. It seems harmless, right? But for people over 60, even a small dose can cause big changes in the body, sometimes bigger than we think. I remember Eleanor very clearly, a kind 76-year-old woman with bright eyes. She was at the hospital for a minor stomach procedure. Before it began, a nurse gave her a sedative, saying it would help her get a little restful sleep. Eleanor took the pill, felt relaxed, and quickly drifted off. But after the procedure, her blood pressure dropped. Her heart rate slowed, and it took her hours to recover. A few days later, she told me she felt foggy-headed. Her speech was sometimes slurred, and she was unsteady on her feet. Fortunately, the condition was short-lived. It was likely a transient ischemic attack TIA, but it scared her. Just one small pill almost made me lose myself, she said. Eleanor's story is not uncommon. As we get older, our bodies become more sensitive to medication, especially sedatives and sleeping pills. The liver and kidneys, the organs that process and filter out drugs, work more slowly, so the medication stays in our system longer. Our nervous system is also more fragile and easily affected. As a result, a dose considered safe for a young person can become too strong for an older adult. On top of that, many older people already have risk factors: fluctuating blood pressure, a weak heart, dehydration, or they might be on blood thinners. When these factors combine with the effects of a sedative, the risk of a mini-stroke or a cerebrovascular complication increases significantly. And what's hard to recognize is that the complication doesn't always happen immediately. Sometimes it's not until a few days after the procedure that a person feels unsteady, has a foggy memory, or finds it hard to concentrate. Have you ever had that feeling getting a seemingly simple procedure, but then your body feels different, as if you've just walked through a hidden storm? If so, the sedative could be the reason that few people mention. This raises an important question. Do we really need sedatives for every procedure? The answer is not always. Some procedures can be done with a very low dose, or even with no sedative at all, using only a local anesthetic or other relaxation techniques. I once had a patient who chose to listen to meditation music during minor skin surgery, and she said the experience was much easier than she expected. Of course, there are some procedures where sedatives are necessary to reduce pain and help the doctor work smoothly. But even then, the dosage needs to be carefully calculated, often at a lower amount than the standard for younger people. I always advise my patients, before you agree to take a sedative, ask the doctor 3 simple questions. 1. Is this the lowest dose needed? 2. Are there any non-medication options? 3. Given my age and health status, what are the risks? You might be thinking, won't I bother the doctor by asking so many questions? I believe you won't. A good doctor will appreciate your questions because it shows you're a partner in taking care of your own body. I often compare a sedative to a dimmer light in a room. It makes the space feel softer and more comfortable, but if the light is too dim, you can't see the path clearly. For an older person's body, that light needs to be adjusted very subtly, just enough to be calming, but not so much that it takes away their awareness and safety. After her experience, Eleanor changed her approach. She told me, I learned that what makes you more comfortable doesn't always mean it's safer. I need to be alert to protect myself. I think her words are something we should all reflect on. So if one day you're offered a sedative or a sleeping pill before a procedure, take a slow breath, stay calm, and remember that you have the right to choose. Don't be afraid to ask questions. Don't be afraid to learn. Health after 60 is like a precious book. Each page should be turned carefully, not rushed through. And perhaps the deepest message is this: medication is just a tool, but the final decision is always yours. Be the one driving, instead of just being a passenger on your healthcare journey. Advice from Dr. Ryan Davis. Looking back at the 7 things we've just discussed, from colonoscopies, with anesthesia, carotid artery, ultrasounds, CT and MRI scans, with contrast to excessive blood tests, stress tests, and using sedatives, you can see a very clear common thread: doing more doesn't always mean it's better. After the age of 60, health is like a piece of music. Sometimes the important thing isn't to add more notes, but to know when to pause and when to leave a silence so the melody is whole and lasting. As a doctor who has worked with thousands of older patients, I've learned that wisdom in healthcare isn't about chasing every test or procedure, but about the ability to listen to your body and ask the right questions at the right time. Remember, you have the right to ask, is this really necessary for me? Is there a safer way? Because each of those questions is a step toward protecting yourself from unnecessary interventions. I hope that after watching this video, you not only have more knowledge, but also more confidence to take charge of your own health. After 60, the journey isn't about going fast. It's about going steady, going at your own pace, and going far. If you want to continue this journey with me, the journey to a healthy, proactive, and happy life, please like, subscribe, and turn on notifications for the Senior Care Wellness channel. Here you'll always find the most honest, easy to understand, and practical advice for your golden years. You deserve to have healthy and peaceful years, and I'll be here to walk with you every step of the way.